Hello, this is Dr. Stanley Lang, and today I'd like to talk to you about the importance of exercise in diabetic control. Now, everybody that knows anything about diabetes knows that exercise is important, and uh, and generally most people know that exercise is important for health anyway. One of the things that I try to do in my medical practice is to actually aim for reversal of diabetes. And when I see a new diabetic patient, I always lay out the possibility that they can actually reverse their diabetes if they're a type 2 diabetic, which is a diabetic that is resistant to their own insulin. So in one of the patients that I saw recently, this patient was diagnosed 2 years ago, pretty much overweight, probably about 150 pounds overweight, but desperately did not want to use any medication. So I laid out my usual roadmap for how you go from being diabetic to controlling diabetes excellently to reversing diabetes. And over the time, we've obviously met many times as I've monitored his progress over the years, and or over the last several months, the last 2 years. And one of the things that's interesting is that he has been very, very consistent in the last 9 months or so in really following the diet to a T. And this particular dietary strategy that I use is a very low glycemic index diet that anybody can eat and follow for the rest of their life. It's very healthy. It's completely different from the American Diabetes Association diet, and it works much better to be able to reverse diabetes. And I've demonstrated this many times over the last 20 plus years. However, it's critical in most cases to also be doing significant amounts of exercise. And in this gentleman's case, I had moved him into a high intensity interval training program, which he was also doing. And he was making steady progress, reversing all of his basic chemistry. And the last time I'd seen him before this most recent visit, he was doing one thing wrong with his diet that he'd forgotten, which is he was eating fruit alone as a snack, but he was exercising very consistently. And in that last visit, we tweaked the diet, got him back into the right strategy. But some things, personal things happened in his life, and he just basically fell off the wagon when it came to exercise, but stayed consistent with the dietary strategies. And in that last 6 months, the last 3 to 6 months that these changes have happened for him, his numbers have continued to improve, but only a little bit. And I think that had he been able to maintain his exercise program, that he would have reached the point of reversing his diabetes, because his blood sugars are essentially normal now. But if he was challenged, if he ate the wrong foods, he would have elevated blood sugars for fairly quickly. So he's not completely reversed his chemistry yet, but he's close. And if he had maintained his high intensity interval training exercise program in addition to his low glycemic eating, I'm pretty sure he'd be at the almost reversed level. He's at the I've controlled it very well, I'm controlling it excellently level right now. So the point is that it's very unlikely for any diabetic to have good or excellent control without maintaining an exercise program that is very effective. In this case, he was able to maintain his gain of control because he was eating so carefully and not eating any foods that raise the blood sugar quickly, which we call the high glycemic foods. But he wasn't able to take it all the way down to where everything is completely normal in terms of his chemistry. And he never will if he doesn't integrate the exercise program. So he came up with a strategy that he can reintegrate on this most recent visit. So if you're diabetic or you know somebody that is, the good news is that if you do the right things, you can reverse type 2 diabetes. It's a controllable by lifestyle condition in almost everybody. There's some exceptions, but it's a pretty small number. And the key, though, is knowing how to eat the right foods, which have to be low glycemic all of the time till you're reversed, and doing the right exercise program. And if these are done together, then the chances of success are much improved. Now, as an aside, he had noticed in his life that when his stress levels went up, his blood sugars tended to go up a little bit. And we talked about using his faith life as a way to combat the stress. And it's important to understand that when you're having significant stress, it does raise your blood sugars. And if you have a faith life, using your prayer for extended periods of time is a tremendous way to activate the anti-stress effects related to our faith life. So if faith is an important part of your life, I encourage you to increase your prayer time as a way to not only have the spiritual benefits, but also it activates the anti-stress effects that can be activated in our body. So I hope you found this review of some of the basics of diabetes control and the interaction of the different simple strategies. I hope you found this review useful. I wish you all God bless and have a good day.